This is Ed, and today is June 4, and the year 2025. So this is a very special show. This is actually part of the series called To Life. Two words, T-O-L-I-F-E, exclamation point. And this has to do with health, wellness, living well, positive. Our very special guest today is Ron Cooper. You know him, he's been on our show before. He's the epitome of the Top Gun attitude, years of military leadership, flight squadron leader, trainer. Excellence is his trademark. We're going to learn an interesting side of things today with Ron Cooper. I'm really honored to present this on Global Business News TV. Welcome to life. We'll be right back with Ron Cooper. Thank you. This is Ed, and welcome back. And let's say a big hello and welcome back to Ron Cooper, the Cooper Culture.
Good day, folks, and it's great to be back with you.
Well, today's show, as I set up just a couple of minutes ago before you came on, a bit of an intro, is a special edition, which I'm calling To Life, T-O space L-I-F-E, exclamation point. And you're going to find out about this and why this is so important today. Here is Ron Cooper.
Ed, thank you always for the opportunity to work with you, your vast audience. And today will be just a slight repeat, but I think it bears going into even a second time. And what I want to talk with your audience about is some suicidal tendencies. And I want to be careful what I say about this. I am addressing military veterans particularly. And Ed, can you see my slides all right?
Clear.
And what I want to do is address what can happen, not always, but it could happen with some military veterans and some of us. I am retired military. I was 22 years Air Force. Some of us leave the military with our identity attached to the military. Some of us have to, well, all of us will at some point make a transition to a civilian career, come out of the military uniform. And some military veterans have their identity attached with the military uniform. And sometimes the transition from the military uniform into civilian life is a bit of a difficult transition. And Ed, my experience is there are some people who don't understand us military people. And I don't think it's difficult to understand us, but quite honestly, I think we are a little different. And I put that word different in a positive vein, meaning well, one of the things that's different about us is that we are trained throughout our military career, and we are assigned wherever the need is, and we adapt to whatever the need is. And so, in the civilian life, we are hired a lot of times principally for a specific job, and it's I would say to a degree in some cases we're pigeonholed, meaning I hired you to do job X, and sometimes we have ideas about career point Y, or let's just say something different about the business for which we're hired. We may have a thought about a different area. And sometimes the people who don't understand us might say, well, I hired you to do X, but you're talking to me about why. And why is that? That's just a potential difference about military and civilian. And Ed, I will tell you that throughout our military career, we go through a lot of training, and we are continuously trained and educated, and that's a lot of the military transition. Just curious, Ed, have you had the opportunity to deal with other military personnel other than me?
I want to answer that very quickly, but first I just want to reiterate to the audience that during the Vietnam era, I was an Army Reserve medic, but not in combat. I was assigned to hospitals, and it was an elite unit, a medical unit um, that had a special mission, and I was very fortunate as I'm not a doctor at all, but I was trained by the doctors in the unit to be an operating room technician to assist them in surgery situations. A lot of that had to do with personal care, one-on-one, taking care of the patients and the accompanying family, if any, when they came in need. And I was trained on doing that throughout the Army Reserve career, which was multi-years. Uh, I did not serve inside Vietnam. I was stateside throughout. Uh, the unit was a very, very special medical training and development, information development, and communications vehicle for the rest of the Army medical units who were in combat. And some of the training was done video long term, a long time ago, and over a long term video training and then distribution of the videos showed surgeons and medical technicians over there how to do certain procedures. And that was the uniqueness of this military unit to which I was attached in Boston. Anyway, with that in mind, that's the closest I've gotten to that. In terms of other military people who have been on this show in the last 5 years, there have been some, but definitely not at the rank and experience level that you possess. Welcome.
Well, thank you, Ed. I appreciate what you just said, but I appreciate your background as well. Thank you for serving our country as a medic. I will tell you somewhat jokingly, we in the aviation career tried to stay away from you medic folks, except for the one day a year where we came in for an annual flight physical. And I will tell you jokingly that, you medical people, yes, you're very skilled in your trade, but we who were in the cockpit knew that if you found anything wrong with us, you could declare us the term we use, DNIF, DNIF. If you gave us any medication, we would be deemed duty not identifiable for flying. And so we always wanted to stay away from the medics because you could keep us on the ground. And yes, for good reason, but we would never want to self medicate. So, at any rate, Ed, thank you for your career. But let me just say very briefly that there are some people who come out of the military, maybe those of us who have served in combat. We sometimes have what is known very well as the PTSD, post traumatic syndrome disorder. And there are some who have various experiences with that, but a lot of us are not going to express very much what it is that may be bothering us or what may be the invisible wounds in us. We've talked about this briefly, and I spoke of these four words just very recently, last couple of weeks. But Ed, I'm a believer that if we choose to invest in, if we choose to engage with others who may be a victim of this silent killer, just so to speak, or this silent ailment we have, if we just exude, even if we don't speak it, but if we exude this belief, I believe in you, we can help a lot of people over what I can consider the silent disruptor in our life, or the invisible disruptor in our life. But very briefly, what is happening at times is that we just need people who are willing to invest time in us, in willing to discuss with us. Many of us, and I was this way, I would never tell you what may be bothering me. I didn't want you to think less of me, and certainly I didn't want to think that, well, I'm a lesser person, but yet sometimes we have things churning in our mind that keeps us from performing at our highest potential. And we may not be willing to tell you that voluntarily until we know you're willing to work with us in a confidential way. And really, we've discussed this a lot, Ed, and the psychologically safe space. And I'll apologize only slightly for presenting some statistics, but it is statistically correct that we've had as many as 22 suicides per day, and that occurs with people. Largely, the statistics are there's more Marines than any other service who are victims of suicide, and that is not a statement of any lesser respect for any one of our services. It is just a statistical verified anomaly. But one of the things that we just know is happening is there are some veterans who have various ailments, let's say different things that are happening within us that we are not willing to share, except with those who are willing to commit themselves to saying, no, let's work together. And many times, Ed, it's just simply a matter of being willing to work with us. One of the things I want to emphasize very openly and clearly with your viewers and listeners, you do not have to be a certified therapist or certified in any particular trade, any particular certification. It is really many times just the willingness to work with us and help us through. And a lot of this is listening, far more listening than talking. But if you're willing to listen to us, we are willing to share, in some cases, many cases, whatever it is that may be bothering us. And I spoke with a veteran very recently who had a problem transitioning from military career into civilian life. And he told me he had a gun in his closet and it was up on the upper shelf. But he asked for a person that turned out to be a good friend. He asked that person to remove the gun from his closet because he did not feel safe having that gun in his closet. In other words, he had some suicidal thoughts. And because the gun is there, he did not know just when he might be feel like walking to the closet and using that gun. And so
So
there
can
are
I
some.
ask a question here? If I could
Please
just jump
do.
in, I don't mean
Yes.
to be disrespectful at all.
No, you're not at all,
Uh,
Ed.
so, uh, it, high level military that I've learned from you in the past several sessions we've had is a mindset. And
It
of
is.
course, physical prep, but it's a total mindset, a mind control. Not that there is mind control, but the what I'm getting, what I've gotten is the training, split second precision coordination training that makes a team work. in dangerous situations is everything. And so when a veteran is taken down from that or jumps down from that level, that perch, that stratosphere of prep and control, that person doesn't know what to do then. Is that correct?
And you're largely correct, Ed, that I do, my life experience is, and I was about to say I do use the expression, and I don't want to call it just an expression, but it is my opinion through life experience that firefighters, law enforcement, and military people have teamwork down to a science. And that is literally a factor that, in some cases, Ed, our lives depend on trusting each other. And we work well with each other because we're training all the time. And you mentioned split second. There are times when any of those three professions have to know what to do. And we have literally maybe just a matter of seconds to make a decision, and we're trained in those kind of situations to where we know it's a matter of critical thinking. We know pretty much what we're going to do, how we're going to react. That is not a statement that we are fortune tellers or anything like that, but there are many times we have literally seconds to respond, whether it's moving fast in an aircraft or we're on the ground and we have a situation occur and we don't have committees and calendars months to make a decision. We have to decide right now. But Ed, what you just said is very correct. It is a mindset. We're trained this way, and there's some other people who just, or there's some people who don't understand that mindset of the military. That's the focus today in this presentation, but yet there's very little difference, my life experience says, between us, firefighters, and law enforcement people. We are trained to think critically and respond within seconds.
So now, first of all, I really appreciate that deep dive. So with all the training that you mentioned previously that goes on, uh, there must be training of stepping down or how to reapply those skills into a civilian setting, a personal setting.
I will tell you, Ed, that there is, or let's say there are seminars of how to transition to, but it is a matter of marketing ourselves. In the military, we have a broad spectrum of skills that we have, and the many employers are looking to focus on a very specific niche. And so we sometimes wonder, well, when I'm writing a resume, what of the skill set I have. And I, in the military, can do a lot of different things because we serve wherever the need is and we adapt to that environment. And we come away from the military with a lot of different skill sets. But to many civilian employers, they're wondering, okay, well, I have a very specific skill set, and I'm not going to interview you or talk directly to you until I first read your resume. And then, okay, so how do I word the resume to where it's appealing to you? And then how do I even know what you're looking for? Ed, those are a lot of very broad general categories of information where we have to transition ourselves. We have to know how to market ourselves to the civilian industry. And that causes, with some veterans, a lot of consternation. And when we go X number of weeks and months without connecting with someone who has even a potential interest, because in a lot of cases, our resumes are being electronically reviewed, we wonder, well, maybe I don't have any skill sets that are marketable in the civilian world. That is how some people think, and that can lead to some very, let's just say, a very fateful mindset. When I say fateful, I'm not saying literally it's going to lead to suicide. Let's just say that it wears on our psyche.
Well, I certainly understand that. And as a talk show moderator here, I'm trying to just think of the training types, life situations that people in the military who are severely trained. In other words, strength and mind control, not of the people, but of the process to prevent injury, to prevent failure. These are really great skills that are totally necessary within the business environment. But there's, I can imagine training, specific training on how to apply, how to think about this
Well, and
is
Ed,
really important.
no, no, you're exactly right, Ed. And it is we do have a mindset, but then how well does our mindset align with our prospective employer?
Right.
And we need to try to make that happen. And so there is, and I believe there are some. I know there's some people, some paramilitary people who specialize in helping veterans transition from the military into civilian life. And in some cases, it is only the military who clearly understands other military people, what we're going through, what we're going to face, and so forth. And so, Ed, I'm going to take us to the next slide. That here are some of the things we need to be aware of. And as we are transitioning, I want to encourage our viewers, our listeners, to be aware of different things that I put the word signs in quotes. Let's just say I frequently use the word data points. And what I don't want to do is label or stigmatize anyone. But if we may be demonstrating some mental health conditions, and I've mentioned PTSD, depression, anxiety, and so forth, that we may have experienced in combat or whatever it is that we have gone through. But just be aware and be willing to listen to. One of the indicators that I use as a very definite indicator is if I'm working with a person who might not want to make eye contact, they might be slow to acknowledge who they are, and that we're listening to various statements they make, and they may be speaking somewhat negatively. That is some of the signs, or let's say data points, I look at, or I'm registering. I'm not looking for them, but I'm aware of them when I am in the presence of a person who might be demonstrating depression, and that could be a form of anxiety. And some in the military right now, we are having some people who are victims of or targets of military sexual trauma. We know that is happening. It's very unfortunate that it's happening. Those who are being discharged with other than honorable discharges may find difficulty in transitioning to a military career. Something may have happened in the military, and hopefully they would acknowledge that, yes, I've done wrong, but yet I'm rehabilitatable. That's my term. And there are challenges relating to the transitioning, as we're talking here. Some engaged in substance abuse because they don't know where else to turn. They're in a life predicament, and they think that sometimes substances will help them over this. And what ends up happening is they get beyond the effects of the drugs, the substances, and the thing that put them into that condition is still there. And then I mentioned earlier in the briefing that lethal means and firearms, nothing inherently wrong with that, But there are sometimes some people, and it's not exclusive to military, but there are some people sometimes who will say, I can't cope any longer with what I'm going through. It seems no one wants me. And now I'm going to go back to one of my opening premises. If we are in the presence of people who believe in us, they literally, genuinely believe in us, they can help us overcome the anxieties, the depression, any negative thoughts. And again, negative thoughts, Ed, that refers to the mindset that you mentioned early on. It is a mindset that if we allow ourselves to get into a depressive mindset, we can talk ourselves into believing I am not sure I have any worth to anyone. Therefore, then the therefore can result in any number of things. But I'm merely saying, Ed, when I say merely, I'm not diminishing anything. As we are speaking with people, and it's not just military, but it could be any person that is despondent in any way, I want to strongly encourage our listeners, our viewers to know you do not have to be certified in any particular science. You don't have to have any particular degree. Just be willing to listen to us. Be willing to register, if that would be an appropriate term, the awareness, the data points that may say, let's go have a cup of coffee. Let's just be willing to spend time with each other. And that goes back to where I was talking about being willing to invest time in each other. Ed, that is a lot of what I'm referring to. That if we are just willing to invest time in each other, being willing to listen, that is a mindset that many of us need to engage in and be better at. Just listen. And as we are willing to listen to people, it is very possible we can help people overcome the despondency of making a transition from military uniform. But again, it's not just military. Any number of people are going through various hardships. They just want someone to listen and someone who may be willing to share life experiences. That can be one of the greatest benefits of our time and our willingness to work with others, that can help others avoid any, let's say, tragic decisions that could come through various forms of despondency. But Ed, just very briefly, those are some of the things that various people go through. I am addressing military because I have that experience with military, but what we're discussing here is not exclusive only to military. We've had people very close to us, about 5 miles south of here is a large bridge, and people have either attempted to or they have jumped off the bridge, and it always results in, or it's a manifestation of people who just say in some form or another, I'm not sure I can cope with what I'm going through, because in some cases, some people don't know of anyone who cares enough to engage with other people. So, Ed, I don't want to oversimplify. I don't want to sound complicating in any form or fashion, but many times it is simply a matter of being willing to invest in, listen to, and be willing to have a cup of coffee with someone who may be silently going through something that is could be life threatening, but it could be lesser than that. It's just they're in need of someone to care enough about them to be willing to listen. Ed, that is largely what I'm referring to today.
This is breathtaking for me, and I'm sure I'm speaking for some audience out there. But I want to go back to the thing that I brought up earlier that, well, for instance, you were as a leader, a trainer and a leader, uh, of elite people. And is there a step? I don't even know what to call it, a step down rather than step up and level up your skills to prevent accidents or to make the right split-second decision, because we're all dependent on each other in the group. Is there a step down, mental preparation step down, whereby the transitioning out of that combat military mindset, which is critical and vital to survival, not for the mission so much, but for individual survival, and they're tied together, I'm sure. But now entering into or getting ready to enter into civilian life and find a job or get into a close marital uh, situation after being separated, there's so many things that can go wrong. Uh, is so that's why I want to go back to the training, the preparation. 'Cause it just seems so obvious that there's a need for this.
And yes, you're exactly right, Ed. And I have no intention of parsing words, but I'm going to say step over, not step down, but I'm going to say step over in meaning, let's just think of it as a sideways step, meaning I'm transitioning out of my uniform into a civilian position. And now, of all the skills I have from however many years I was in the military uniform, it doesn't matter whether it's 2 or 32, we have a skill set. And then now it's a matter of how do I present myself? And so we all have to learn how best to do that. We need to be able to put it into a written form as a resume, but we need to know how to speak with I call it frequently, speak resolutely, that I specialize in, I am good at, various terms we can use, but of the skill set I have, I teach those who are transitioning out of uniform to civilian life, learn what the prospective business employer needs, what his, sometimes we call it pain points. What are the pain points they have? What is it that they are doing in their overall role within the business? But there's sometimes the businesses have those pain points that, well, we need help with. And so as the military people learn these different needs, we transition ourselves to, and I specialize in whatever the needs are of that company. So we may have 20 different skill sets we have through our military careers, the training and so forth, but the civilian who doesn't understand the military might be saying something like, I don't need the 22 skill sets you have, I just need one. And so, Ed, we need to help those transitioning out of the uniform to be able to articulate with confidence, I specialize in. And that is a skill set that we know that company needs. It takes time to study a prospective company, and it takes time to know how to market ourselves. And it is not, in my life experience, it's not a one slide presentation and you got it, you're done. In many cases, Ed, it could be 6, 12 months working with a person to help them identify the skill set that matches the various companies that are that have an opening for job skills. That's a long answer to your question, Ed, but it does require a fair amount of work in staying with a person to make that transition.
To what extent were you involved at all, you or your unit, with USO?
Not directly involved with the USO. I do when I'm in various airports. I will visit the United Services Organization departments or categories that they have right there, and we do monetarily support USO. And so I would encourage people to support the USO. It can be done monetarily, it can be done with writing, just knowing that the civilian population supports the military, and it can be done through the USO. So that's how I have been, and actually Marty, my wife, and I are currently monetarily supporting the USO, and we sign letters to various military personnel, because we know what it is to be separated from those who are back home, and then there is the separation fatigue. We have to learn how to get back with each other. So that's all a part of supporting the USO.
Well, it's all part of mental health. Joanne and I have had that experience here in San Diego at the airport. It's huge military population here, not just active, but veterans. Anyway, this is a really interesting and very, very important topic that needs more time. Maybe a continuing theme that we could address, not every show, but perhaps, well, why not? A segment of it.
No, and Ed, you're exactly right that perhaps twice a year, some frequency, yes, mental health right here is one of the major topics that needs to be addressed. And it's not limited to military people, but mental health. How do we think about things? Do we frequently verbalize negative thoughts, negative expressions? That has a lot to do with our mental health. What do I think of myself? I don't want to overthink of myself, think more highly than what I should, but I want to do what I can to help people have a very healthy mental attitude, to where they know they have something very positive to offer different people. And as we can help people with that mental attitude, I know, and I've dealt with numerous people, when I ask them, what are you good at? What is your strength? And some people will say, I don't know that I'm good at anything. And I would say everybody has strengths. It is a matter of determining what those strengths are, and then we build on those strengths, and we develop the strengths, and those strengths are going to might necessarily change throughout our lifespan. And so what gave us pleasure some years ago may not be what brings us pleasure today. But those are all the things that are involved in having a healthy mental health, mental attitude, of which you're very skilled in, Ed.
So, mental health is a very, very important thing because everybody is involved and everybody has issues, and some don't want to be talked about, that's for sure, but others are okay to talk from.
Yes, and Ed, maybe bring this in for a landing. That here is how people can contact me, and I want to make certain again. I'm going to reemphasize: I am not a skilled, I'm not a certified therapist, psychiatrist, anything of that nature. My medical career has to do with going to the flight surgeon one day a year type thing. And so I have no medical background. And so I want to make that very clear. But but I am very aware of the various things that can happen in the mindset of a military person. And it's not exclusive to military, it can happen to anybody. But this is how people can contact us. This is my website, my email address. Marty, my wife, is my business partner. And I do speak publicly. I conduct workshops and seminars. I can do it in virtual or in person. I prefer in person, but I can work either in any capacity with various people. But as I can help people understand, and I work with leaders to have the right culture in a company that we want to project, that we care enough about other people within our company that, as I've emphasized many times during this presentation and others, uh, when we are aware of what could be the various symptoms, those who are suffering from any kind of negative mental health may not verbally express that until and unless they know they're within the confidence of people, and we call that a psychologically safe space. But I would welcome the opportunity to work with and speak with anyone about these type of situations such that we can get the maximum performance out of people, because those within the organization, the leaders, know they care. And that's the attitude that is going to get the very best out of their people.
So your words, that slide, I invite you to put it up again. I believe in you. That
And
is
that
sincerity.
those are some of the four of the most powerful words in the English language, or in whatever language around the world. But Ed, when we are willing to invest in other people such that, well, and they don't even have to verbalize these words, but our actions will show it. I believe in you. And when people know that and they're willing to invest time in others, and much of that time is listening, we can help people through various life difficulties to help them have a very positive mental attitude.
Thank you, Ron Cooper. This has been a learning experience for me, and we're going to make sure that it gets out across the media.
Well, Ed, I always appreciate the opportunity to share with you and those within your audience, and it's a great opportunity to share. And as we are literally investing time in other people's lives, it will benefit an organization, for-profit organization, and productivity and profits. But when you have people who are genuinely gratified with those with whom they're working, they will give their maximum performance.
Amen. Thank you very much.
Well, thank you, Ed. It's always great to be with you.
Thank you, sir.
All
Okay,
right.
this is Ed in San Diego, and that's Ron Cooper in the Metro DC market. Take care.
Thank you, Ed.
Thank you.